Alright, so in the previous video, while assessing for cranial nerves 3, 4, and 6, when assessing her sight using accommodation, I noted that there was no nystagmus, which is the back and forth oscillation of the eyes. So moving on, I'm going to be assessing cranial nerve 5, and I'm going to need to touch your body. I hope that's okay.
It's alright.
Alright. So I'm going to palpate your temporal and masseter muscles. So I'm going to need you to clench down your teeth, bite hard. The muscle tone is symmetrical. It's felt on both sides. It's symmetrical. It's felt on both sides. And I'm going to try, while clenching your teeth, no, just relax your mouth, just clench your teeth. I'm going to try to push down your chin. There's a resistance. The resistance is equal on both sides. Alright, so moving on, I'm going to be testing your sensory under the cranial nerve 5, but I don't have a cotton for this. I'm going to just use a piece of tissue paper, but obviously the patient doesn't know about it. All right, could you close your eyes for me, please? Thank you. Okay, so you're going to feel some light sensations on any part of your body. Just tell me yes when you feel the sensation. Okay.
Okay. Yes. 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 Yes.
Perfect. So I'm going to be moving on to cranial nerve 7. This is also called the facial nerve. Okay. So it has both sensory and the motor aspect. Okay. So for the motor aspect, I'm going to need you to smile. Equal on both sides, and frown. Okay, it's equal on both sides, and I'm going to need you to raise your eyebrows. It's symmetrical. Then I'm going to need you to puff your cheeks with air. Then expel the air slowly. Okay, it's symmetrical. I'm going to be I'm also going to be assessing your taste. That's the 2/3 anterior part of your tongue. Is that okay?
No problem.
So you're going to have to close your eyes, and you're just going to feel some powdery substance on your tongue. Okay. When that touches your tongue, just tell me what that tastes like, okay?
Okay.
All right.
That's sugar.
Perfect. That's the sugar. All right. Okay, so moving on to cranial nerve 8. This is our acoustic nerve, and this is also a sensory nerve. So I'm going to be testing her ability to hear normal conversation, which we can see that she has a normal response to hearing normal conversation, because we have been conversing and I'm assessing her and she's responding, so she has normal conversation. Then I'm also going to be doing the whisper test. So I'm going to whisper to you, then you tell me what you've heard, okay?
Okay. When? Please.
Okay, so both ears, she has the normal response on both ears. So moving on to cranial nerve 9. This is the glossopharyngeal and the vagus nerve. Cranial nerve 9 and 10. We're going to be testing them both together. So because it has both the sensory and the motor aspect. So moving on, I'm going to be assessing your pharyngeal movement. That's the movements of your uvula and the tonsils. So you're going to feel, I'm going to use this as my tongue depressor because I don't have a wooden spatula. So this will suffice as a tongue depressor. So you're just going to feel a pressure on your tongue. I just want to assess rather your uvula and how your tonsils vibrate towards the midline, okay?
Okay.
All right. Let me grab my pen light. So you're going to say ah when you're ready. When I tell you to, okay?
Okay.
Say ah.
Ah.
Okay, so we can see that her uvula vibrates and the tonsils move towards the midline, which is the normal response for vagus nerve. So moving on to cranial nerve 11, which is the spinal accessory. This cranial nerve 11 is the basic nerve. It's a motor nerve. So I'm going to be assessing her trapezius and sternomastoid muscles. All right. Okay. So trapezius muscle. So we can see that the muscles on the trapezius and the sternomastoid muscles are equal and symmetrical. So moving on, I'm going to be palpating her shoulder against. She's going to shrug, and I'm going to apply a resistance, and she's going to explain the sensation. So you're going to feel a light and pressure on your shoulder. Then you try to shrug. Okay.
All right.
Perfect. So they are equal muscular strength, or rather tension, on both her shoulders. All right. So try to move this. Move your head this way. Equal muscle tension. Try to move that way. Equal muscle tension. So another test, another assessment for cranial nerve 11 has to do with